Good morning, everyone. I'm Dottie Cordell. I'm the director of the Student Health Clinic at San Diego City College in downtown San Diego. We are a diverse, proud community college in a more urban area of our county. We are so happy that you have chosen to join this incredible panel here today to discuss the COVID virus, vaccinations, and this panel is specifically focused towards the impact of access, illness, care, mortality of the COVID virus on communities of color. We will be distributing information after the webinar about where you can locate this recording online. Just one little guideline, we have received some pre-submitted questions and the attendees are muted in this webinar, but you do have a question and answer box. And we will share questions from the chat with our panelists. Panel members here are experts in medicine, nursing, public health, and infection control. They represent diverse communities of African Americans, Filipino, Filipina, Filipinx, and Hispanic communities. They are each highly active in their community work, and we will soon have them introduce themselves. After they introduce themselves, we are going to ask you to complete a few poll questions so that we as the panel can get a better idea of where you stand with your perspectives and understanding as attendees. But first, we are very grateful to have Dr. Ricky Shabazz, the president of City College, come in today for a short time and say a few words. So welcome, Dr. Shabazz. Thank you for joining us today. I know it's a super busy May month, and we're so grateful you could attend. Thank you.
Well, thank you, Dr. Cordell, and thank you to the entire panel. And those that are watching via Zoom or webinar, this is a very timely subject that hits very close to my heart. And we have to acknowledge that we are living during a pandemic. It is affecting us all differently, but is absolutely affecting us all. It hits home to me because my mother-in-law, who is a Black Brazilian, Afro-Brazilian, we just put her on a plane back to Brazil against my better judgment about 2 weeks ago, but she was very clear that she wanted to go back home. We were fortunate enough to get her fully vaccinated before we put her on that plane. But we also recognize that we're still learning about the efficacy rate from different communities, particularly the fact that we know that in South Africa and in Brazil, there are different strains of COVID. And so this is science at its highest level. And I'm so happy that we have a panel of scientists who are going to help us better understand this. Dottie, as you well know, we don't believe in vaccine shaming. It is a personal decision whether or not you are going to be vaccinated. In full transparency, I waited probably to the last minute and I'm happy to say, have my date set for the next couple of weeks. I wanted to learn more about the different vaccines. And as we get to the CDC's approval of the two vaccines that have been studied probably the most, I'm at a level where I'm comfortable setting a time to go and get vaccinated as I look to travel or be able to travel out of the country, which is something I love to do. So just wanted to thank the panel and also say that we're very fortunate to have not only Dottie, but Dr. Armstrong, who is our acting director of our nursing program. And so we get to learn from two scientists in their own right. And I would be remiss if I didn't acknowledge that we have another scientist in a nurse, former nurse, in our vice president of instruction. So as a campus, we're surrounded by health professionals who can help us better understand how to navigate all this information that is out there about COVID. Welcome to this very timely webinar, and I look to learn from our esteemed panelists.
Thank you, Dr. Shabazz. Thank you so much for attending. And as you can see, perhaps in the panel, we are grateful to have Dr. Parker and our Vice President of Instruction, Matilda Chavez attend today. So without further ado, I'd like the panel to introduce themselves, tell everybody a little bit about who you are and what you do.
I can start.
Yes, Dr.
First,
Seon.
good morning, everyone. Thank you, Dottie. Thank you, Dr. Shabazz. I love that personal touch and your personal story, both around your mother and then also your personal experience with the vaccine. And so, and understanding. So my name is Seon Thihaloli Pavan. I'm one of the public health doctors. I'm board certified in preventive medicine. I'm coming at you live from the Emergency Operations Center from the county where I've been here really more than a year and responding and helping respond to the COVID pandemic. I used to be the deputy public health officer for the county, and now I'm a medical consultant, play all types of roles in the COVID response. Thank you.
Thank you. Pearlie, would you like to introduce yourself?
Of course. My name is Perlita Aguinaldo. I am the president-elect for the Philippine Nurses Association of San Diego, a professional organization of nurses here since 1974. We are lucky to be in collaboration with the county workforce and outreach education, and that's how we get started to be introduced to this kind of experts as well. I am also the chair of the PNASD COVID Task Force, and the rest of our mission I will say on my little presentation. Thank you, and glad to be here.
Thank you, Pearlie. William Cardona Santos.
Good morning, everyone, and thank you for the invitation and the opportunity. I am honored to be here. My name is William Cardona Santos. You can call me Will. I was born and raised in Puerto Rico. I have a bachelor's degree in nursing from the University of Puerto Rico and a master's degree in nursing leadership and management from Walden University. I have been a nurse for 27 years, and 14 of those have been in infection prevention and control, where most of my time as an infection preventionist was with the VA system. So I worked at the VA in Memphis, in New Jersey, in San Diego, and New York. And I'm also working nowadays with Kaiser Permanente as an infection prevention and control, of which the entire pandemic, we have been in constant communication with not only with the county. Dr. S is is the second time that I meet him, but I have been with Grace Can, with Trace Lanier, and also Maggie Turner, who are also nurses in the county, epidemiologists. And we are in constant communication with them, in constant training with Kaiser Region, and also in constant training with the Centers for Disease Control and Prevention and the World Health Organization. So I'm here to help in any way possible. I also was a past president of the National Association of Hispanic Nurses, the San Diego chapter. I'm a co-chair of the San Diego APIC, which is Association for Professionals in Infection Control. And I'm also a member of the Holistic Nurses Association. Thank you.
Fantastic. Thank you, William. And Dr. D. Armstrong at our own San Diego City College School of Nursing.
Good afternoon, everyone. My name is Dr. Demetrius Armstrong. I'm the acting associate dean at San Diego City College, and I'm honored to be in that role. I also would like to share that I'm also a volunteer for Health Impact. So I'm very honored, and I've been working with Samantha administering vaccinations at Bayview Baptist Church under the guidance of the Black Nursing Association. So welcome, everyone.
Thank you, Dee. And Samantha, I'm so happy you can be here today. Would you like to introduce yourself? Oh, you're on mute, Samantha.
Thank you. Thank you so much. Hi, everyone. My name is Samantha Williams. I am a family nurse practitioner, and I am chair of the COVID-19 task force for the San Diego Black Nurses Association. I'm also currently practicing in primary care. I've been in nursing for over 18 years. One of my passions is absolutely community care, especially for underserved and minority communities. And we know that it has played a huge part and how the pandemic is played out among those communities. And so I am honored to be here to speak with this panel and discuss a lot of the topics that we have on board today. Thank you.
Thank you so much. Another guest panelist is Andrew Gonzalez, who is a leader in the county and affiliated with San Diego Public Health. He works for Champions for Health, and he is busy in the field right now setting up a point of dispensing to vaccinate, and will be here just as soon as he can. Have I missed anybody? I see another name on here that says my name, but is that anybody I've missed? Okay. At this time, before we get into presenting some content, the panel would very much like to see some poll results from you so that we can get an idea of what your thoughts are and what your vaccination status is and what we can offer to you. So here we go. Please feel free to answer and we will. Great.
17%, 75% vaccinated.
There you go. Fantastic. I see that some people are not going to get vaccinated, but I'm grateful that you're still here and that that you can learn other aspects about the virus that hopefully will be of help to you. Thank you, Caesar. Can we do the next one? A lot of people vaccinated.
And by
Caesar, can we get the next poll? Okay. Do you think you understand the concept of herd immunity? Okay. I guess the country's doing a good job of getting that message out. A lot of people are familiar. Okay, next question. Do you think you understand what viral mutations or variants are? Okay, again, a lot of people very educated in the audience. If you're hesitant to get the vaccine, would you be willing to tell us the area that you're most concerned about? These are very familiar areas of concern about the rapidity with which the vaccine came out, safety concerns, the fact that it's emergency use authorization, and questions about whether there were enough community of color members in the clinical trials. So we thank you for answering that question. I think we just have one more. Right. What do you think might help you perhaps feel more open to the concept of getting vaccinated for this virus? So some of you need more information from what you see as trusted messengers. Other people really want to see how things work out for those that have been vaccinated. Other folks want it to have FDA approval rather than emergency use authorization. And some people are fairly well decided on whether they're going to get vaccinated. Thank you, Caesar, so much. So with that, I would like to ask Dr. Sayon from San Diego Public Health to give us a little bit of opening comments about the virus, how we got here, mutations, anything he would like to introduce as concepts for us.
Will do. And hi again, everyone. Dottie and team, sorry, I need ability to share my screen, but while we're doing that, I just want to take a moment and acknowledge first, Happy Nurses Day, starting the Nurses Week. We can't be more appreciative of nurses than we really, than ever, really, right? Especially during this pandemic, these healthcare heroes that we so acknowledge. And then May is Mental Health Month, I believe, too. So I just wanted to share, I don't know if you could see this, but this mask I have from Behavioral Health, mask your face, not your feelings. I just wanted to remind us to continue to be in tune with ourselves and make sure we're taking care of ourselves. I do have ability. Thank you, Caesar. And I'm trying to see, give me 1 second, sorry. And I wanted to say that I'm going to be focusing on San Diego County data, even though this is clearly a global pandemic. So let's get into it. I have about 15 minutes of discussion. And so this is, again, even though this is a global pandemic, I'm really going to be focusing on San Diego. It is extremely sad. And I know many of you are hearing in the news some of what's going on in these red areas, which is, you see this Times graphic on the bottom, on the left side of the screen, showing South America and India and the cases of the proportion of cases amongst all cases across the world significantly increasing. On the right side, you do see that unfortunately US is still #1 when we think about total number of cases, and I don't have deaths up here, and deaths, but India is quickly catching up, I'll say. And then there's of course questions or concerns that some of this data might be underreported in different areas. So this guy or girl, this virus, I should say, coronavirus, is really why we're here, right? This virus, as cute as it is, has really put our whole world at a standstill, and why we're talking about this. So I just appreciate all you all being available to have this discussion. This, what you're seeing, is just a snapshot in time. We have a weekly report linked at the bottom. And so this is with the data as to end of last week in terms of cases. And you see how many cases and unfortunately how many deaths we have, over 3,700 in San Diego County. And amongst those cases, 6% are hospitalized and about 1%, slightly over 1%, do pass away from the disease in general so far. That said, there are differences, things to know, like the median age of those affected or infected by coronavirus is 35, whereas the median age of those who pass away from the disease is 77. And median is median, right? And so that's not everything, that's just where the majority of folks are around. And so you see this huge age range from 0 to 108 and 10 to 106 and for deaths respectively, that changes. So other ways to visualize it, this is from Tuesday's meeting with the Board of Supervisors, the presentation. Over 50%, almost 55% of cases are in folks who are 20 to 49 years age range. Another way to visualize what I just showed is this, and this shows age groups in 10-year increments. And you see that, I suspect that many of you are within the 20 to 29 age group, or maybe the top of the 10 to 19. And you see the 20 to 29 age group is the #1 age group in terms of infections, not just in numbers, which is the blue bars, but also when you look at the orange line, this is the case rate. And the rate is the standardized per population. So even when you do it as a rate and do that standardization, young adults are leading in terms of being most infected with coronavirus. And why does cases matter, right? We talk about cases a lot, and up until a couple of months ago, it was very accurate to say that cases are an early indicator of future hospitalizations and deaths, and deaths are a lagging indicator amongst those three kind of variables that I mentioned. And now with vaccines in the mix, we do know that just because you're a case does not necessarily mean, that those folks get hospitalized or die, but we have to continue talking about that and still identifying cases so we can get ahead of the spread of the disease. And I'll talk about that in a second. Dottie had mentioned, and in the survey, and I found it great to have that survey earlier on to see where you all are in terms of thinking and understanding and things like that. And so just wanted to spend a second talking about these variants of concern. So the CDC and WHO both have definitions. They publish and they talk about which are variants of concern, and they discriminate amongst them. And so generally speaking, about November or so, we learned what we kind of already knew and expected, right? Viruses, they do mutate and they survive. And so some different viruses, when you're talking about all viruses, mutate to different degrees. Coronavirus happens to be a virus that is mutating very often and frequently. And it mutated since we even became familiar with coronavirus. And it's just that up until November-ish, most of the mutations or the variants were not really of significant clinical or public health concern. And then we started learning about things like the UK variant or the B117 variant and South African, and we talked earlier about the Brazil strain and things like that. And these have different characteristics that are definitely more concerning. They're like the UK strain, for example, which is the dominant strain in San Diego County, and the country really is more contagious, not only more contagious, but more lethal. And there's data to support that. We're learning a lot more about certain newer strains like the India variant, for example. But this is an example of just on the left side, the UK variant, when you look at it as a proportion of all of the variants of the cases that we do genetic sequencing on in San Diego County. And please know that San Diego County is the second in terms of doing genetic sequencing in the US behind Houston. And so you see B117 has quickly kind of really taken over in terms of the variants, whereas the California strain, for example, there's two flavors of it, if you will, and the main one had decreased over that same time. So the B117 or UK seems to be outcompeting the other strains. Okay, this is just another thankful example of really how vaccines are working. The cases are dropping and they continue to drop. They're still not where we need it to be though. So we don't want to have a half-finished job. We still have a lot of work ahead of us and arguably a harder road ahead of us now that supply has caught up with demand. Hospitalizations also have tremendously decreased, and we're continuing to see that, which is reassuring, but cases are not distributed equally. And this is just one example. This is our dashboard where you can look at different jurisdictions or zip codes and see that they do differ across the county. And that has been the case throughout the pandemic, where some parts of San Diego have been harder hit than others. And as a reminder, San Diego County, we have rural areas, we have urban areas, we're a border county. So there's a lot of different dynamics to consider. This is also showing that not only are cases not distributed equally, deaths are not distributed equally. This is national data from the CDC's Vital Statistics Group, just from the first half of 2020 data when they looked at the death data. And I haven't seen a more complete analysis for the rest of the whole of 2020, but they showed and they found data showing that non-Hispanic Black males, for example, were 3 times as likely or more likely, to die than a white male. And then Hispanic males 2.4 times, non-Hispanic Black females 2.3 times, etc. So they did find disparities. And we have data in that weekly report that I mentioned. I know this is probably small for you all on the screen, I apologize, but you can click on the link and see. We have data on cases, hospitalizations, and deaths respectively in these 3 figures, showing the differences by race, ethnicity. And that's one way you can look at disparities. Of course, there's geographical, like I said, rural and urban, there's age, there's gender, things like that. There's other ways you can look at disparities. But you can see that, of note, things like when you compare, for example, right, the Hispanic Latino group, the cases is significantly higher when you even look at age-adjusted rates of cases amongst Hispanic. It's around 3 times more, for example, than white individuals in San Diego County. Interestingly, there's also data like this. So Black, there's a number of 5,118 and 4,194 for white, Black and white respectively. But when you look at the hospitalizations, even though the disparity here, it shows that Black folks do get COVID at higher rates than white folks in San Diego, when you look at hospitalizations, that disparity increases even further, right, to even more than double the amount of hospitalizations. So then that also talks to already pre-existing health disparities that certain communities may already have. They may have more underlying conditions that put them at higher risk of more severe COVID, which may land them into the hospital or unfortunately have lead to death, more death in certain groups. So it is important to acknowledge that. And you see this group that is significant in terms of cases, well beyond even the Hispanics, and that is NHPI. And in case you can't read the fine print, that's Native Hawaiian Pacific Islander. Yeah, and then we do have good news, though. I'm not only here to tell you bad news, I promise. And so that is that there is this light at the end of the tunnel. The tunnel has been a really long tunnel that we've all suffered and fatigued from over a year now. Unfortunately, coronavirus doesn't care about our fatigue, but because of the improving data, the state has said that their tier system, you may have heard the red, purple, whatever tier system color we were in, that is ending in June, mid-June. So there is some kind of resumption of normalcy, and this is going to be a new phase in terms of, or new normal in terms of how we coexist with coronavirus continuing to be in our world. And so this is, only will happen if there's continues to be enough supply for vaccines, if hospital rates continue to stay low, and there may be common sense measures like wearing masks that continue. We have to wait for more details, and it depends all on how we're doing as a state, locality, and a country. But I do want to remind people to reopen responsibly, right? Like, we know that you can declare victory too early, like these images show, and you may be wrong sometimes. So and we're not all the way there. So we have to keep doing things. Before I transition to vaccines a little bit, I want to say that even though the bulk of what we're talking about these days are vaccines, it's still critical to follow the public health interventions, masking indoors especially, and things like that, and then also to identify testing, right? If you have coronavirus symptoms, you are the tip of the iceberg. Really, that's the easiest group to try to identify who may have coronavirus. Not everyone gets symptoms, and as a reminder, if you do get, whether or not you get symptoms, you can spread coronavirus for up to 2 days before you get symptoms, if you get symptoms at all, right? So testing, especially in anyone who has one or more coronavirus symptoms, just to rule it out, even if it's unlikely, is very helpful, right? Because if we test, then we know, and we don't know what we don't know if we don't test. And so if we test, we can identify who has coronavirus and then get ahead of it by looking at their close contacts and quarantining them before they develop coronavirus and further spread the disease. And as a reminder, every case was at some point a close contact, right? And then, so that's why contact tracing is very important. And then treating, we know that people who are at higher risk for severe COVID, there is outpatient therapy that's available in the last couple of months that's really evidence-based and supports and really helps people stay out of hospitalized if they get these what's called monoclonal antibodies. The former president got them. A lot of folks are getting them in San Diego. We have centers around the county, and many medical institutions have their own centers as well. And so we know vaccines work. Okay, so I'm going to talk about vaccines now. I mean, this is data-driven, science-driven. There were clinical trials, and there's what happens in the clinical trials, and then there's what happens in the real world. So there's a word called efficacy that they use in the clinical trials, and then they talk about effectiveness when it's real world data, and that's the difference. And we have study after study, including our own local UCSD, UCLA health systems produced studies looking at vaccines and the effectiveness of. So we know vaccines work. This is one example from CDC that was shared, I think, last week or two. This is where we are. Our goal as a county and as a state is to vaccinate 75% of those who are fully vaccinated, 75% of those who are eligible for the vaccines. Today, that means if you're 16 and over, next week, it's likely to go down to 12 if the FDA and CDC are okay with data that Pfizer submitted for based on some studies they've done. So where we are right now, of the goal, which is slightly over 2 million San Diegans, we are over 55% of the way there. But when we look at all San Diegans who are 16 and over, we are about 40% who slightly over 40% fully vaccinated. And fully vaccinated means both doses or one dose if you get J&J, one and done, and waiting at least 2 weeks after that final dose. So here are some wonderful, I love ads and pictures, right? Vaccines are the way to get back to normal. And period, right? We know that vaccines work. You may remember just even locally, we had a huge hepatitis A outbreak, if for those of you who are from San Diego, but it was in many other parts of the country as well a couple of years ago. And we vaccinated our way out of that outbreak. That's how we got out of there. We had, just to put more probably relevant for you all, just a few years ago, we had a meningitis B outbreak in SDSU, and that, got a lot of attention, and we vaccinated our way out of that. So, this is the way we get out of and get back to normal, get out of for COVID. And it's especially important because vaccines can really form that barrier or shield and allow less opportunity for the virus to replicate. And the more they can replicate, they can continue to mutate. So we know about the variants we know right now, but we don't know what the future variants are going to be like, and they could be worse. And we want to minimize opportunity for the virus to replicate. I love this about the summer. And then this is a great ad from New York City. You should ask questions. You have the right to ask questions. And we want to make sure you and everyone else has the most up-to-date factual information so you can make the best decision for you, right? And then last thing I wanted to say is that I know that there is some politicization of vaccines. And so I love this ad of Republican doctors from Congress talking about the vaccine, in case that's helpful too. And then CDC put out this chart, which I really like too, really talking about risk, right? Whether or not you're vaccinated, we talk about sometimes some people as easy, or some people want to simplify and just talk about things as being safe or not safe, but really risk is a continuum, and it's whether things are the safest or the least safe. And if you look on the left side, right, unvaccinated folks, anything indoors, none of them are the safest. They're either least or less. And then for outdoors, there are a few things that are safest for unvaccinated people. On the right side, for fully vaccinated people, everything is the safest. That's because vaccines are really, really effective. And they're not just effective at getting the disease, they're extremely and even more effective, I'd argue, at preventing hospitalizations and death, right? And that's the whole reason why the economy slowed down, or all these restrictions were in places, because the healthcare system was getting overburdened, and we wanted to avoid things like what had happened in New York, in Seattle, I believe, or Washington in the beginning, and Italy, and now what's going on in India, where someone doesn't even have COVID, but they can't get care or adequate care, and then you see more suffering and death because of that healthcare overclogging. And hopefully this type of thing serves as really an additional motivator, right, for being fully vaccinated. And I do know and want to acknowledge that I know that there's kind of data interesting, and sometimes you hear about these one-offs and some things like the J&J, Johnson & Johnson, they had these safety signals that were identified, and sometimes that is scary, and it absolutely is scary hearing that and seeing that in the news. But that doesn't get as much attention as the lives saved from the vaccines, right? And we have to put things in perspective and also understand that the monitoring system is working in real time, right? These are the most monitored vaccines in the history of vaccines. This I'm gonna let others talk about. So I know, Will, you were going to talk about the herd immunity concept, and then just wanted to say there are many ways to actually get vaccinated if you haven't already, and if you are interested in it, or if your friends or family are interested in it, then one of the ways is through our sites, but the county run sites, but there are plenty of other options, your local pharmacy, provider, etc. And on our website, we are saying what type of vaccine is available, etc. And we are expanding hours now to 8 p.m. for 3 of our sites. Last 2 slides is really one, why should younger individuals consider getting vaccinated? And my 3 main points are: protect yourself, your loved ones, and community, and enjoy the freedoms of being fully vaccinated and helping the community at large and the world get back to normal, right? And these are reasons. And just because you're less likely to get hospitalized with COVID, many of us know people who have suffered at home from COVID, including myself, knowing other people who've suffered at home. You could get long COVID, which means you have symptoms for a while longer, just after you get COVID, and even if you're not infectious. And then especially some youth can get multi-system inflammatory syndrome. It's rare, but it does happen. And that's, I think it. Oh, and sorry, and I threw in this one last slide just because I know a lot of folks, and I just saw in the poll, continue to have questions. And again, you have the right, and these are good questions. These are the quickest vaccines developed in the history of vaccines. So, what does that mean? And does that mean anything was rushed? And the answer is that, it was quickest, and it was a scientific breakthrough because, and political breakthrough, I'd say, because they were able to, Operation Warp Speed, they were able to eliminate that red tape, that process. And yes, these were authorized for emergency use versus the traditional approval process, but they are going to be going through that approval process for now too. And really a lot of steps were either done simultaneously, but they were all still done. The only big difference is that you only need 2 months of post-trial data versus 6 months for the full approval. But like Doctor said earlier, right now, especially the mRNA vaccines, they have the full 6 months of data, and they've released that data, and it's really good. So they're going to be submitting for approval soon. So happy to answer any questions, and I'll stop sharing and give it back to you, Dottie.
Thank you, Dr. Sayone, for incredible packed information. I just want to call out 2 things before we turn it over to Andrew for a moment, who's been able to join the panel and can tell us about Champions for Health. But I want to just ask the audience to remember the hat that Dr. Sayone showed at the beginning, which said, "Mask your face, not your feelings." And while we're going to be talking a lot about the vaccine and a lot about the medical consequences of the disease, yeah, I want to acknowledge that there are a lot of our mental health professionals on the call today, and to remind all the students from City College or in the district that are listening that we are here for you with telecounseling and telehealth appointments to try to meet the really tough feelings and things that many people are going through. This is a mental health pandemic also, and I just thank Dr. Sayone for bringing that out. And we will be getting into the details of a lot of the data that he showed about communities of color, disproportionate impact, and higher rates of disease and death. But first, I would just like, we're very grateful to have Andrew Gonzalez on, and I told everybody, Andrew, that you were busy out in the field, but I'd love if you could introduce yourself and tell them about the incredible work that Champions does.
All right, sorry guys, just coming back to the office from a pod, but hi everyone. Andrew Gonzalez, Director of Community Health for Champions for Health. Some of you may have heard my name out there in the world, or heard about Champions for Health. But we are the medical nonprofit arm of the San Diego County Medical Society. Our old name used to be the San Diego County Medical Society Foundation, which is a mouthful. So I'm glad we're Champions for Health now. But basically what we do out in the community is work with everyone that you see here. We're a small organization. We're small but mighty, but we can't do it without our partners who are on this call. Like the Black nurses, the Hispanic nurses, the Philippine nurses, and all the school systems, including you all that either have helped us out in the past or AKA will help us out and being voluntold to help us out later for hours. Hashtag y'all are amazing. But basically what we do is we try to make our pods or just healthcare accessible. As you know, and as you might have heard, it's been really hard for a lot of people to get access to the vaccine, whether because they don't have access to technology, it's not in their language, they don't have transportation, everything that you hear, right? So we go out there into the community to sites that are really accessible and people feel comfortable going to, whether that's their church. So if you partnered with the Black nurses yet, you may have helped them out at a few of their sites. If you have helped us out recently, we've partnered with the Philippine Nurses Association to do some of the hard to reach areas, like at a few senior centers, at a few spots that are just really people just be really comfortable going to those locations. So, and the great thing about the work that we do as well, along with the Black nurses, is that we try to make everything super easy. So we have it in the language that it's that community needs, right? Whether it's Spanish or Tagalog or Vietnamese, everything is paper-based. You know, people feel comfortable with that. It's accessible, even if they may not be able to write their name. You know, we have volunteers or support staff that can help out with that. So that's kind of the work that we do. So far, I think we vaccinated, and I'll send an email out to everybody as well too. I think we vaccinated about 1,300 to, yeah, no, I'm sorry, let me get that back. 13,000 to 15,000 people since mid-January when we started everything. So to give you some context, our flu season is usually about 3,500 to, as of recently, 6,000, just from this past flu season, because people were really anxious to get their shots. But to do close to 15,000 San Diegans in 4 months is insane. I have all the forms to enter to prove it, which is driving me crazy. But again, this is all because of all the partners that you see in front of you, all the leaders that you all should look up to and hopefully aspire to be, because we need you. We need you to have these conversations, oftentimes hard conversations with the community, with your colleagues, with your family, because at the end of the day, they trust us. You know, they may not say it, but they trust us. And so thankful to be on the call and thankful to have you guys as partners.
Thank you, Andrew. We're so grateful for the work that you're doing every day, and that you were able to make time for this today. We've mentioned the Black Nurses Association, the Filipino Nurses Association, and I want to turn it over to the panel. Dee, I'd love, Dr. Armstrong, I'd love if you could discuss maybe the ways, any part that you want about how you have partnered with Black nurses with Samantha, or the work that you've done with Andrew via Champions for Health.
Thank you, Dr. Cordell. I just want to say that I received the email from Andrew and Dr. Foster on December 24th, Christmas Eve. And that email just summarized that they needed help. So on that night, I emailed them back and I said, count me in. And I learned so much by being on the sub-advisory committee to bring to San Diego City College to start our own vaccination clinic to get approval with our MOA, which has been approved. So I am honored with the support of our leadership team at San Diego City College, we're going to be moving forward. So we'll be able to vaccinate our students, our staff, and faculty, as well as the community that we serve. And the way I end up meeting with Samantha is because I also joined the Health Impact Committee, and they send out emails, and I saw, oh my God, the Black Nursing Association is need volunteers at Bayview Baptist Church, which I really think the Pastor Brooks for allowing us to use his facility. So I signed up, and I also invited students to attend this event. So the students came, they was very excited. We did probably like within our pod, each time we was there in my group, we did at least 100 vaccines during that time. So with those 2 days, we did over 200 just within our spirit table. We call our name was the spirit table. So we did about 200 each day that we was collaborating together. And I just thank Samantha as well as Andrew for allowing our students at San Diego City College to be a part of this historical event. And I just want to tell everybody, it's very important that you understand the reason why you need to be vaccinated. You know, we want to go back to normalcy. And I could tell you, I have a 21-year-old and I'm teaching and preaching and giving him the guidelines why you should, pulling up articles, showing him risk factors. And it's very important that, because we need you guys are our future. So we really need you to really understand, come and talk to us, and we will guide you on the reason why you need to be vaccinated. But we're not pushing you, but we just want to encourage you to get vaccinated. So, and finally, I also want to thank our nursing students, and I do want to give a shout out to our nursing faculty, because without our nursing faculty and students, we wouldn't be the stellar program that we are today. So I have to just bow down to our nursing faculty and students because they making this happen. And on the final note, I also would like to thank Family Health Center for allowing our students to be a part of their team to come out and vaccinate their patients, and teaching them the guidance and the responsibility of being vaccinators as well as becoming future nurses. So thank you.
Thank you, Dr. Armstrong. And many people have mentioned the Black Nurses Association. And I want to acknowledge that one of our panelists has a lot of things going on right now at home. And if it's a good time for her to speak, that's great. But also I want to acknowledge that it's AAPI Heritage Month. And I would love if Pearlie was able to speak and give us some perspective on that community and the impact on the disproportionate impact on the Filipino community.
Would love to. Do you want Samantha, or I can do it? Hi, my name is Pearlie Aguinaldo. I was just going to be like Dr. Dimitrivs to share to you what PNASD is doing, the great things that we are doing for the community. But yesterday, I went out to lunch for a leader, a Filipino advocate of this AAPI program. He's actually the founder of the APEC, which is the same concept as the API, Asian Pacific Islander. And I said, why don't I share this to this panel? There is a disparity, and we are celebrating Asian Pacific Islander Heritage Week. So here I am, I called Daddy, and she said, of course you will. So let me tell you, throughout the United States, Filipino, I'm gonna focus on the Filipino disparity, but I think this whole concept applies to everybody in this Asian Pacific Islander thing. So this integration, I think, is the main focus. I'm gonna share my slide. You see it?
Yes.
Okay. This integration of I'm covering my slide. This integration of health equity, the impact on the Filipinx community. That Filipinx is a tongue twister for me, but it includes everybody. Throughout the United States, Filipino communities has been negatively impacted by COVID-19 at a higher rate than any ethnic group. Negatively impacted is the point. There's a lot of reason to it. There is a disproportionate number of Filipinos in the healthcare system, the frontliners. Mostly a lot of nurses are frontliners. Also, a lot of Filipino families live in a multi-generational household. So this economic solution can translate into health risk, facilitating the easy transmission of COVID-19. It could just be cultural, but it is contributing to the transmission of COVID-19. And also exacerbating this concern is the heightened prevalence of some chronic illness common among Filipinos, hypertension, all the pork that they want to eat, the adobos that we want to eat, the diabetes, a lot of cardiovascular disease are common among Filipinos. All of these collectively, we're not blaming the vaccine, the virus, but it is a fact that we are one of the highest deaf health workers in this. Filipinos are aggregated under the term Asian Pacific Islander, which obscure how Filipinos are impacted in the health disparities system. So this integration must be done, and this integration is the only way that we can single out which of these ethnic group needs what kind of what. So in California, oh, I have to start my slide. Oops, too fast. Okay. Here, I'm going to talk about COVID death. In California, Filipinx American make 4% of the population, 1.6 million Filipinos. Out of the 39 million Californians, we make 1.6 million. And the significant proportion of the population are in San Diego, San Francisco, Stockton, Los Angeles, Riverside County, and those are the one. Filipino Americans are substantial portion of this healthcare system. And 20% of the nurses population in California is Filipinos, 20% of the total nursing population. So data shows that 30% though, out of that 4% population are the death data of healthcare workers are Filipinos. The death data is so unfortunate. The burden of COVID-19 in the Filipino-American community is hidden in an aggregate of Asia category in public data system, making it an overlooked aspect. Vital discussion of resource allocation, outreach education, all the economic relief, healthcare, and mental health support are being made with the aggregate data in the process. So that masks the whole disparities of support given to its ethnic group. Just like I mentioned, the most common, there's a lot of diabetes, hypertension, cardiovascular disease that are a disparity rate, among these. In California alone, the type 2 diabetes, there's the diagnosed one consists of, we are much higher than all the Black, Latinos, and other ethnic group combined in type 2 diabetes. So I'm talking about the death, and this is one, the CDC, this is a little late, this is in November of 2020, just to tell you the impact of the rate. Filipino makes 30%. Are you able to see my slide?
Yes.
Yeah, here it is. 3% population, but our death rate is 31%. On the Latino, their population is 39% and it's 36% death rate, which is also very high. And the white, you are a lot more, the safer end. And the Black nurses, 5%, this is in California, and so on. The point is 3% versus 31%. What a disparity in that aspects, what I'm trying to explain. This is in Hawaii. The same thing, there's a lot of Filipinos in Hawaii. And I just want to point out here, out of the gray is the population and the 20% is COVID cases. This is not death. But look at the very close, there's even more death cases than the registered population. So this is this disintegration issue. Why is there more than the cases? So that's one thing that, and why are we concerned about this disintegration among ethnic group? Especially now on COVID-19, the health outcome can help the Filipino community as much as the other ethnic group. There are some misconceptions among public health practitioners, healthcare workers, researchers, policymakers, lay people that COVID-19 is taking a disproportionate toll among Filipinos. It's not taking, it is taking a disproportionate toll. There's also an increased sense of urgency surrounding the COVID vaccine, which is not a problem now, I think at the beginning, of course, but now it's open to everybody. But that would also, those who are higher risk should be given more priority in the vaccination tier. Also, strengthen occupational health protection for essential workers. Filipinos are very patient. They'll work under any condition. They'll work on any pay, and this is unfortunate, but it's the reality. So all these facts can also open up things. Optimize the allocation of funds and support, which is very important for all ethnic groups. And this is something I like, to further mobilize the Filipinx community to join health equity initiatives to build a greater solidarity within other communities that are disproportionately being impacted, like the Black nurses, the Latino nurses, Native Americans. And I'm proud to say that I think last Thursday, we had a meeting with Samantha Group and the Latino nurses, forming a stronger vaccination force, putting our forces together to help out in all these vaccination centers, collaborating with Champions for Health, and or the Black nurses have their own vaccine. We don't have, we just collaborate and provide the workforce for them. And what we're trying to do on our end is the outreach education. We have been involved with the county as they trickle in the request for presentation to us. We go and we've been giving presentation to different sectors of the community, and we're trying to do it at a smaller scale now, on a conversational approach to make a difference, because we're dealing with different age groups now, and they have their own reason for being hesitant. So outreach education, there was a presentation that I did, and after my presentation, they said, "Oh, Pearlie, I'm sorry, we're 90% vaccinated," after the fact that and I told them, you know what, that's great. You all decided to get vaccinated, but please share the informations that I gave you today, because one word will make a difference. It could just be a key message to another person, and that person gets vaccinated. So that's that. And another important point on this is to recognize the significance of social and structural determinants of health. I mean, talking of determinant of health among Filipinos, the income inequality, the food insecurity, the lack of access to quality health care, hazardous work conditions, and all that are all important. Today, the need for timely reporting of this integrated Asian American health outcome is very important. At this stage of the pandemic, accurate reporting of this integrated COVID-19 death and infection rate is a matter of improving science and public health. And just like Dee and Dr. Sayon had said, you know, science is very important, that we need to do all this. And I think that ends my presentation, but I would like to share a little bit more about what we're doing. That Andrew, we have vaccinated 6,000 out of the 13,000 of Andrew's rate. We have put in 600 hours of vaccination to the community. We go where they go. We vaccinated the farmers of Fallbrook, of Encinitas, the barbers, the nail salon ladies who don't want to leave their salon and need to be vaccinated. So small clinic communities where they are, and we're enjoying it. We're making a difference to the county, and it's all because of our collaboration with you guys. When we created our task force, we started with giving webinars to our nurses, just to give them information about COVID vaccine. And we were lucky to have 4 experts from the county to give the presentations, and that was great. We are thankful for all this collaboration that we're doing. This County of San Diego, I'm part of the outreach, education, and the workforce, which has done an impact, and of course with Champions for Health. And thank you to answer some of your questions. I'm a critical care nurse by trade after 40 years, but 15 years, I tried different hats in nursing field, but I enjoyed the challenging patient in the ICU. So that's my expertise when I retired, but I love to teach. So I'm here. And thank you very much, Dottie, for inviting me.
Thank you, Pearlie, so much. And everyone knows the contribution that the Filipinx nurses have made for generations to healthcare. My best and favorite teacher in nursing school was Filipina. And you have pointed out the incredible health disparities in the death rate of the healthcare workers comprising 4% of the force, and yet dying at a rate somewhere around 31 or 34%. And that is tragic. I would like to turn it over to hear from William. He has incredible expertise as part of the Hispanic Nurses Association, but also his knowledge in infection control and in immunity. And then I'd like to see if we could get into some of the reasons for the health disparities that we find with COVID, with Black, Latino, Filipino people. But William, if you could start us off in your areas, I'd be appreciative.
Thank you, Dottie, and thank you for the opportunity again. I think as an infection preventionist, the challenging task of not only dealing with this pandemic, but also as you guys were talking, I was reporting an inpatient to the county because we have to report inpatient positives to the county. And we also have to report deaths to the county. And I think that has been one of the most challenging tasks as an infection preventionist, especially during the peak of the pandemic, where we didn't have any visitors allowed into the facilities, yet we have deaths where people were not able to say goodbye to their beloved ones, especially in the ICU. So hence the importance of vaccination. And before I start talking about herd immunity, I'm gonna assign the students to, when they get a chance to watch the history of pandemics, if they go to YouTube, they can watch some videos about the history of the pandemic and how humanity has survived during 130,000 years that we have been on this earth. And the reason why we're here, especially during the last probably 200 years, was because of vaccination. So vaccines are saving lives, vaccines are very important. And communication is really important among all of us. And knowledge is power. Personally, I'm not a fan of the news because they can offer some misguidance or mislead. I think it's very important, especially nursing students and professionals, to go to the accurate sources like public health, CDC, and the World Health Organization. The Hispanic Nurses Association has been collaborating with Champions for Health for many, many years. And during my tenure as president, we were able to also assess and send students and volunteers. And that was before the pandemic, like, for example, taking blood pressures, going to churches and all that stuff. And we haven't stopped that collaboration because, you know, Hispanics compose the second most populated in the United States, and it's still growing. And the fact that, you know, for example, we are here with the border and we see, you know, this undocumented workers that are trying, or they come here for a better life. And in the process, they're afraid of going to healthcare just because they're afraid of being deported. That's a major challenge among the Hispanic population. And it is entities like Champions for Health and nonprofits like the Black, the Hispanic, the Filipino Nurses Associations that we provide care. Because I think, in my opinion, and you don't have to resonate with me, That's where most of the disparity is. And I have friends that live in Mexico. I have friends that live in Colombia. And they have told me stories where Mexicans have to pay to get tested or have to pay to get vaccinated. And that's a major disparity for the majority of the population who doesn't have the resources to pay for that. And in Colombia, I have a friend in Bogota who was telling me that, they get international students in universities, but some of the students were coming from Haiti and they were not being screened. So you can see this is a public health issue, and that's why I love public health very much, because we see the disparities not only locally, but also globally. And when we talk about herd immunity, the World Health Organization has a specific definition that I'm going to quote, and then I'm going to provide an example for the students to understand. But the World Health Organization defines herd immunity, also known as population immunity, quote, is the indirect protection from an infectious disease that happens when a population is immune either through vaccination or immunity developed through previous infection. However, the WHO supports achieving herd immunity through vaccination, not by allowing a disease to spread throughout any segment of the population, as this would result in unnecessary cases and deaths. And we have seen this through the pandemic. Before we didn't have the vaccine, the virus was spreading very rapidly. And a lot of people, rather than getting the herd immunity, especially the most vulnerable populations, and there are a lot of risk factors, morbidity, mortality, comorbidities, like, for example, in my experience in the hospital, we have seen a lot of diabetics and morbidly obese being the first ones to die. So there's a lot of issues that immunocompromise an immune system as we age. And if on top of that, we have comorbidities like heart disease, high blood pressure, obesity, diabetes, that puts us in a greater health, risk. So vaccination is the best way to do herd immunity. For example, when I work in a hospital, and this is way before the pandemic, we were talking about herd immunity with staff during the flu season. And what we say is, like, we offer the vaccine to patients and employees. Employees have two choices. In California, there is a mandate to be vaccinated with the flu. Otherwise, if people reject the vaccine, they have to wear a mask during the entire season. But when a patient refuses the vaccine, as long as most of the staff is vaccinated, that person is considered protected as long as they stay in the hospital. However, let's take, for example, a Hispanic who lives in a very rural community where most of the people probably have not been vaccinated or don't have the access or are afraid of going to get the vaccine. When this patient is discharged to that community, that herd immunity is no longer available for that patient. And that patient is at risk of, for example, getting the flu from the neighbors. So that happens with COVID-19. And that's why we're trying to promote vaccination as much, because there are going to be certain exceptions. There are going to be people that might be allergic to the vaccine, or there are other considerations to take, because remember, the vaccine is in the process of being approved. And I was vaccinated with the Moderna, and I can tell that the second shot wasn't fun, but I went through it. And when I really weighed either getting the side effects of the vaccine versus getting the COVID, I rather went with the former. So, and interestingly, my parents who live in Puerto Rico, they recently got the vaccine, but because they're over 55 years of age, they were telling me, we didn't get the side effects that you got. So it seems like in elderly population, it doesn't happen as much, which is a good thing. I think that, all of these people are going through a lot to also have these side effects when they're having many comorbidities. But, like any medication, and I was discussing this with the panel before we had this panel, any medication can cause a side effect. And side effects can be mild, especially if you take the medication for the first time. And some others might be, could be fatal. But the same way that we are willing to take an antibiotic, which can cause a multi-drug resistant organism in the future, I would be more concerned about bacteria because of that, because we're taking antibiotics, sometimes it's not correct. So in sense of herd immunity, the bottom line is the most people that we can get vaccinated, the better, because if we have at least 95% of people vaccinated, that 5% that for some reason cannot get vaccinated, has some sort of indirect protection. So I want to leave it here. I just want to thank you again for the opportunity. Infection prevention, let me tell you, there's a lot of people that are senior infection preventionists, and after the pandemic, they're willing to retire. Others are tired, probably they want to move to other specialties. So the need for infection prevention is going to be high, mostly after the pandemic. So for the students that find this as a potential specialty, it is fascinating, it's complex. If you love microbiology, you can love infection prevention. I'm learning to harmonize with the bacteria rather than sometimes, you know, it's kind of futile to kill them all the time. So we have to learn to live in harmony with them as well. They were here before us, they're going to be here after us. And I was looking at this history of pandemics, and I didn't know that bacteria evolved about 3.5 billion years ago. And viruses evolved about 1.5 billion years ago. And we have been here only 130,000 years. So you can tell that they know how the earth goes. So I'm gonna leave it at that. And if they have any questions at the end of the presentation, I'll be more than happy to answer. Thank you.
Thank you so much, William. And I want to acknowledge one of the questions that was on the chat for the panelists, and that was asking us if all of the panelists have been vaccinated. I think we have been. Yeah, yes.
Yes.
So, yes. And so I want, yes, Dee.
I will receive my second Pfizer shot on May 14th. I was waiting for the approval of our own vaccination clinic, but when my husband said, I'm getting vaccinated, join me. So I went to side with my husband. So we got vaccinated together. So we,
Wonderful.
yeah, so.
And Samantha Williams is now able to join us. And I would really love, Samantha, if you can talk about yourself and the work of Black Nurses Association. It's been mentioned many times on the panel. And I know you speak very well to some of the reasons that has been brought up in this time that we've been together, that there are incredible disparities in communities of color. And if you can speak to your work, your activism in that area, and some of the long-held health disparities in communities of color, I so appreciate that.
Absolutely, absolutely. So I'll just give a small historical background about the African American community, and in regard to some of those hesitancies with the COVID-19 vaccine, and some of the misconceptions that many people have. Some of the mistrust that communities of color have with our government, and rightly so, due to past treatment that really isn't so past from the US government. And I'll just add that although I'm speaking primarily from the African American perspective, I want to be clear that these inequities and some of the atrocities that have happened have occurred across communities of color. This is with Latin Americans, some of our Asian Americans, brothers and sisters, as well as Native Americans, of course. So as a chair of the San Diego Black Nurses for the COVID-19 task force, we focus our efforts not just on targeting our community to vaccinate them, but also in large to provide education and awareness to our community on how exactly they're impacted. So I want to speak a little bit, like I said, about vaccine hesitancy and what that really means. And in order to talk about that, what that means for minority communities, we really have to understand that it's not just about hesitancy in regard to the vaccine itself. It very much so is also connected to our historical distrust of the medical and scientific field. And that fear was earned. It's a very earned distrust by this country. And we really can't move forward and make the impact that we're looking for in terms of, herd immunity, in terms of decreasing the disparities until we actually acknowledge the fears that these communities have. So let's just start with the antebellum South. In the antebellum South, we're talking the 1800s, right, of the African-American slave period, where African-Americans were enslaved and experimented on. During this experimental process, we had a lot of villains in this process. Due to time, we'll just discuss a few. One of them is known by the name of Dr. Marion Sims. This is a very controversial figure. For many, he's not known as a villain, but for the African-American community, he is. Dr. Sims, he's known as the father of American gynecology. However, much of his research is founded on his experimentation of Black women. Appallingly so, he completed these surgical experiments on Black women from 1846 to 1849. These were 10 African-American women who were enslaved in the South, and he did over 30 operations on them without anesthesia. He perfected his technique with the objective in mind that when it came to operating on white women, he had a very solid technique. These women went through so much pain that they had to be held down by other enslaved people just to be able to go through the surgery. And they switched to enslaved people holding them down because the other doctors couldn't stand the screams. They couldn't stand the sound or sight of what these women experienced. So when African-American women say that there's this historical trauma from the medical institution, please understand that this is a very real and ingrained history. As we go on, we see that not only did African-American women, not only did Dr. Sims experiment on African-American women, but he also experimented on African-American men and children, which is rarely talked about. It was thought that when Black infants were born, that their skulls were too tight. So Dr. Sims would try to loosen up their skulls with what's called a shoe awl. And if you've ever seen a shoe awl, it highly resembles an ice pick. These procedures were 100% fatal to infants. So again, when African-American mothers, women, men talk about an ingrained distrust in this system, it is a very earned distrust. Medical experimentation didn't just stop in the 1800s. It expanded well into the 1900s. One example is in the 1920s, we have the eugenics program, which was the sterilization of women, particularly African-American women and children. This US sterilization program was adopted by Nazis in Germany. Sterilization of African-American women and children was done for the presumption of promiscuity, the presumption of mental feebleness, in which they considered, these children to have an inability, children or women to have an inability to take care of themselves. However, among many African-Americans, it was just considered racial profiling and an excuse to commit this atrocity. From there, we can move on to the Tuskegee Experiment, which many of us are aware of. But just to notate that this experiment lasted for 40 years, from 1932 to 1972. And this is a time and I'll say 1972, right, which is not that long ago. And this was a time when African-Americans thought that they were receiving a cure for the disease and did not know that they were being experimented on, only to later also have autopsies performed on them just to find out how this disease ravaged their bodies. And so I'll also notate that many of us have heard of Brown versus Board of Education, which we know is a desegregation of schools, but have you ever heard of Simpkins versus Cone? Simpkins v. Cones is regarding the desegregation of hospitals. And we may think that this was, maybe early in the 1920s, but this was in 1964. This is not that long ago. So this is in the era of our grandparents. This is something that our parents would remember. And again, this is among communities of color. And so until the Simpkins ruling, most hospitals in North Carolina and throughout the South did not accept African-American patients on equal basis and did not allow Black physicians to admit patients or train as interns. So prior to this ruling, African-Americans had to travel over 50 miles, sometimes depending on where they were. And en route, they would often die due to these emergency situations. And so it's important for us, during our conversations that we're having with our community members, just reminding them that although a lot of these atrocities have occurred, and again, I only named a very minute few, but just reminding them that where we are in 2021 is different. Not only do we have a lot of communities of color, prominent figures with their eyes on the data and the research, but they're also very much so behind it. And we're very thankful for that, the progress that has been made. However, we know that everyone within our community has to make this decision on their own accord and in their own time. So regardless of that decision to vaccinate, while we have these events, these vaccine events, we continue to just highly encourage our community members to wash their hands frequently and wear their masks, decrease their risk by keeping their circles small, and just do as much as they can to minimize their exposure to this deadly disease. Along the way, we have definitely attempted to amend our vaccine events to make sure that we can have opportunities to discuss have these conversations with them, so that we can reach as many people as possible. Although minority communities experience these disparities, we know that it doesn't just stop with healthcare, and that it goes into those social determinants of health, right? And that's abbreviated by the SDOH. And the social determinants of health encompasses healthcare access and equality, education access and quality, economic stability, neighborhood and built environment, social and community context. So due to time, I'll just, discuss one aspect of that, and which will be the economic stability. Over the past half century, African Americans have made substantial social and economic progress by gaining political rights that have long been denied them, and entering professions from which they've been blocked, and largely by overcoming centuries of overt racism and oppression. However, these visible signs of improvement, they really mask the deep inequities that tens of millions of African Americans are exposed to. And they're exposed to much fewer opportunities to achieve good health and political influence, as well as prosperity and financial security than other Americans. An example is that a 2019 study found that over 97% of respondents vastly underestimated the huge gap between the median wealth held by Black families in comparison to white families. That median wealth was for Black families was $17,000, and for white families it was $171,000. That's a ratio of 10 to 1 that still exists today. So we know that sometimes even though you only see a small category or aspect of these disparities, that it's across the spectrum of a person's life. So, like I said, what I just described in the economic stability is really throughout all of the categories in regards to social determinants of health. There was an IOM report that was published in 2001 addressing healthcare equality. IOM stands for the Institute of Medicine. This report was titled Crossing the Quality Chasm, a new health system for the 21st century that should provide care that does not vary in quality because of personal characteristics such as gender, ethnicity, geographic location, and socioeconomic status. So we also have various other renowned organizations and governing bodies like WHO, which is the World Health Organization. And all of these organizations and governing bodies, they have very admirable goals and objectives to address some of the concerns that I mentioned earlier. However, we also still have very senior politicians, congressmen, public figures, as well as a vast majority of the country that feel that racism and these issues and concerns don't exist due to racism. So while I'm not here to debate whether or not racism is real or very true in this country, what we can say, what we do know is that the data speaks for itself. So with all that is going on in our country in terms of social justice and healthcare equity, we're starting to relearn how that intersects with racism. And I use the term relearn because much of this has been documented decade after decade, century after century. And in fact, the only real new thing we're learning is that several of those above mentioned categories within the social determinants of health are actually worse now than what they were decades ago. So I'll end all of this with a quote from MLK, which is that of all forms of inequality, injustice in healthcare is the most shocking and inhumane. And just to discuss briefly, because I know Dottie, you also mentioned what the San Diego Black Nurses is doing. And so we started not as early as we had liked to within the pandemic when the vaccines were available to start vaccinating our community. But we started in February and really going through those faith-based institutions to reach our targeted population, which was the African-American and Hispanic and Filipino communities. Keeping it very limited in terms of promotion, where it was only channeled through our community health workers and promotors. And so we have successfully been able to vaccinate 3,500 people at this time, which is a lot for our organization, nowhere near Champions for Health. And it's not in competition. We are thankful to have their support. They've been extremely helpful in allowing us to reach and have the impact that we have had. And we have been able to partner with the San Diego County, which has been an amazing experience, as well as a lot of our nursing schools. And what's most closest, nearest and dearest to our heart is being able to partner with schools like City College and like Southwestern College, who we know that a lot of our minority students attend, and really allow students to have that experience of working in communities of color. As we know, we all move on to be clinicians and healthcare professionals, and it's very different when you see people of color in the healthcare system versus in their community where they feel safe. And it's a different level of trust. So at the beginning of every event, we give a very sound orientation in regards to transcultural competency of how you treat communities of color in regard to respect, in regard to just how, basic ways that you speak to them. And so that has been very healing and very building, and I think very essential as just, based on the fact that it's not something that is regarded as high as it should be within our nursing programs sometimes, and even for sure within our medical programs. So we have been thanked a lot for that. And our community has definitely felt the difference in terms of how they experience access to care within the community versus access to care within the hospital setting. And so I'll leave it there so that we can have more time for discussion and the rest of our panelists. Thank you.
Thank you, Samantha. You inspire me, as does this whole panel. And I knew I'd get emotional. And I just want to emphasize what you said. The word is being used that people of color are vaccine hesitant, and that minimizes the experiences that you described. That one word, oh, I'm a little hesitant. It is, as you said, very well-founded hesitancy and mistrust of an establishment of healthcare and part of societal racism that has not served people of color. And we could have much more discussion on that. And I thank you for drawing that out for us. When I conceived of this panel, I thought about that we needed to be in uncomfortable spaces and talk about some of these hard things. And I just want to thank you. I do believe that we need to continue to have trusted messengers to try to work within communities of color to hopefully demonstrate the changes that we continue to hope are afoot to end the racist healthcare tendencies that people of color have experienced. And I would like to talk more on this, but we're running out of time, and we want to acknowledge our wonderful attendees. And Dr. Sayon has noted that one of the attendees had a question earlier.
Sure, and thank you, Dottie. Excellent talks. I love and respect everyone on the panel too. I accidentally, I think, did something and got rid of Taylor Prentice's great question. How do you feel about those who are waiting to see the effect of those who have been vaccinated? And I'll start, and I welcome others to join in. A couple things I want to point out, right? One, as I mentioned, even though these were developed in record time, one thing I didn't mention, I did say that, the steps were essentially still completed. Most of the immediate effects of vaccines in terms of kind of larger side effects are found within the first, few hours, if not, and then safety signals are usually found during trials. And then when you expand it to, millions of people, usually identify things right away as well, which is what happened with the messenger RNA vaccines. As soon as they were outside the trials, they started noticing these rare events called severe allergic reactions or anaphylaxis. And then J&J, same thing. Within the first month, they detected 6 cases, a safety signal, enough to show that adverse event. One other thing I wanted to mention is that even though these vaccines were developed in record time, the technology has been underway for decades. It's been studied, and the technology behind one of them, the J&J, and then also AstraZeneca, which is not authorized in the U.S. yet, has been actually used in the real world with Ebola vaccines. And then lastly, the mRNA vaccine technology is used with animals. And sorry, the J&J vaccine technology is used within animals, viral vector, and that's used in the US with animals as well. So with veterinarian diseases and preventing those. So I think that, and I want to your question, Taylor, really, it is natural for us to, not want to try something right away when it's new. Some of us are early adopters, some of us are not. And that may depend on the topic and what it is. You may want the new iPhone or whatever Samsung phone right away, and some of you may want to wait, till the glitches get worked out. So it's natural, but it's been over 6 months, right, that these mRNA vaccines have been out, right? There haven't been any other thing other than those severe allergic reactions, which again are really rare, and we know how to react to. We have the tools at the sites where the overwhelming majority of these do occur, if they ever occur. So really, you should rest assured that these are the most monitored vaccines in history, and they continue to be studied. The reason for emergency use authorization over approval, by the way, I mentioned the 2-month versus the 6 or more months for traditional approval, really is because time matters, right? In those several months, thousands of people continued to die from COVID, and especially with the US going through the surge. Could you imagine if we didn't start the vaccinations in December and instead waited an additional 4 months, right, when we had all those people pass away in between? Then we at some point were like what India is facing now. We're around 2,000 deaths a day, and so that would have delayed. And really, so you can argue the ethics. It was crucial that they authorize them as soon as possible with the early data. I'll hand it over to anyone else in the panel who wants to add.
Thank you, Dr. Sayon. I want to be respectful that I knew we would want to go for a long time today, and we have reached the end of this panel, but I want to reach out to our incredible panelists. You've enriched my life by getting to meet you all and have you on this panel. And if anyone has a last concluding remark, we'd be honored to have you, but I just want to thank you again so much on behalf of the college and the community.
Yeah, thank you, Dottie. I'll just say one last thing, right? Whether or not you were infected with COVID-19, our lives and livelihoods were all affected by COVID-19. And so we know there's been so much tragedy, whether it's health related, business related, economy related, mental health related, etc. And these are the tools that will help us get back to normal the fastest. So just want to really encourage you all to think about vaccinations if you haven't already. Thank you.
I just want to say real quick, I lost 2 former coworkers to COVID. I almost lost a friend. So I think that if my former coworkers that died would have had the opportunity of having the vaccine, they would have said yes. The other thing that I wanted to say, I forgot to, for the students to watch, if they have Apple TV at home, there is a sensational documentary that is called The Year Earth Changed. And it's, even though it's talking about, you know, how the planet changed during the pandemic, I think it's worth seeing both sides of the stories, because, you know, God knows, or the Lord knows, the reasons why we had this pandemic, but nothing happens by accident, in my view. There's always a reason for being here. And the fact that we're resilient and we're doing something about it counts a lot. So thank you so much for this opportunity.
Yeah, and then I'll mention last thing in the chat, I did put in our site interest form. So if you know of any good places that we can reach the community that really need it or are hesitant, as we all talked about. For example, we were doing a pod, you know, right outside an apartment, and some guy was like, y'all are just really doing shots out here? Like, really? Like, yeah, you know, come and get yours. So you got to be creative. We got to make it happen. And we need your support, because you guys are the smart ones. I mean, the panel's cool and all, but, you know, we rely on you guys. So thanks, everyone.
Thank you, Andrew.
I'll just add that June 15th is coming, and that is when I believe California and possibly the rest of America plans to open up. And I would just, you know, admonish everyone to please do not get caught out there unvaccinated when the country is opening up. We just highly, highly encourage everyone to be protected, protect yourselves, protect your loved ones, and those who are at greatest risk.
Okay, I hate to end it, but I guess we'll say goodbye and thank everyone. Thank the panel and our kind attendees. Thank you so much, everyone.
Learn the facts and get the vax.
There you go.
Learn the facts and get the vax.
I love it. I love it, Pearlie. Thank you.
Yeah. Thank you.